Okay, well, thank you everyone for tuning in and welcome to CTO Talk. I am your host, Matt Ferrari. Today, we get to spend 30 minutes discussing issues, challenges, opportunities that are impacting healthcare tech. You can, of course, follow the show on Twitter at #CTO Talk or follow me at MP Ferrari. With me, really excited today. I've had the opportunity of knowing InfoBionic for quite a long time now. And with me, I have Dave MacCutcheon, the COO, Chief Operating Officer at InfoBionic. And today I really wanted to have the audience get to hear about, patient engagement and kind of that transformation in the age of AI. So Dave, welcome to the show.
Thank you. I'm happy to be here and appreciate the opportunity to be on the broadcast.
Excellent. So let's just dive right in. Dave, I'd love for you just real quickly to give yourself just a moment to give kind of an introduction of who InfoBionic is and, how you came to join the organization.
I joined InfoBionic about a year ago as the Chief Operating Officer while looking at some opportunities to make an impact with a startup company and to look at what they were really doing differently. One of the things that we often see is that companies come to the market as an imitator or a me too. And what I found really interesting about InfoBionic was a couple of things. One is that they had a really innovative software and hardware platform combined for mobile cardiac telemetry, doing something nobody else was doing, which is providing a full disclosure 3-in-1 device. And on the back end, the part that also makes it really interesting is the use of artificial intelligence to basically interrogate every single heartbeat of every patient on the system and to provide alerts to physicians who then have instant access to the full disclosure data to make diagnosis. And this is just an entirely different approach to treating and diagnosing heart disease, where we look at other systems that are reliant on recording data, having it processed remotely, waiting for a report to be sent to a physician. InfoBionic really was looking to change the model, bringing the technology to the patient and to the physician and marrying them in such a way with artificial intelligence to deliver something that is really unique in the market. I had, at the time, been working with a company called Envoy AI that was a spin-out of Terra Recon, an imaging company. And Envoy AI was set out to build a platform to host AI solutions for medicine all across the spectrum, focusing primarily on the use of AI in imaging, but expanding into things such as genetics and workflow improvements or even insurance reimbursement improvements. So it was the combination of those two things, really a unique approach, as well as leveraging AI that brought me to InfoBionic.
Excellent. And I wanted to lead with that because I wanted to hear your perspective. I mentioned that I've known InfoBionic for quite some time, and I love, when we've talked a lot about in the past on this show about kind of the different approaches and think differently. And certainly everyone, I think, either has personally experienced or has a family member that has experienced, some kind of ambulatory cardiac monitoring process or system. And I just love the way that, we are thinking differently about, kind of the future of what this patient experience should look like. And, that kind of leads me into my second question, Dave. What are from a patient perspective, what are they expecting from healthcare organizations as far as the engagement and personalization, compared to just, 5 or so years ago, kind of previous to all the, Alexa and Siri and voice-like capabilities that are out there today?
Yeah, it's a really good question. And, we have an opportunity to work directly with our clinicians and get feedback from patients, as well as you mentioned, each and every one of us probably has a family member or close friend who's had to wear one of these cardiac monitors in recent times. And I can say that what I'm seeing, or what we're really observing, is some distinct influences on what patients expect in the way that they're being engaged in their healthcare, And many of the ways these things happen all converge. So there's a growing segment of patients, people, I would call them customers, but people don't like that term. It's really an odd term to use, and I think we need to get back to calling patients patients. And they're asking to get more engaged in their healthcare decisions with many times a focus on wellness and prevention. As our society, we've been improving the standard of living, and there's an expectation that we're all going to live longer and healthier lives. And the awareness is somewhat driven by TV ads, application ads and pop-ups, and news stories about medical and scientific advances, kind of on a daily basis. You're starting to have this, we'll call it constant input that makes you aware, and then that promotes engagement. I would say to somebody, how many times after hearing about all the terrible side effects have you heard the term ask your doctor, right? So that's one of the things that's actually, patients are expecting to be engaged. They're actually going to their doctor's office and asking. When we look at the other thing that's impacting the engagement model, it's that millions of Americans switch their healthcare plan every year. And with that comes its own set of challenges. The biggest drivers of the choice of their healthcare is that they change employers. So that's about a third. Another third of the change in healthcare plans is because their employers change the offerings. And then there are these big life events, births, marriages, unemployments, or whatever. But this creates the need for the patient to become engaged now in selecting a new doctor, a new pharmacy. It's also in time that they've got to install new apps on their phone or update contacts. And what they expect is some guidance and some help, give me some direction on how to get myself set up and take control of my health in the new system. And I would say, lastly, maybe the third part of this that really is driving this transition of the increased awareness is the individual, as you pointed out. Individualization in healthcare was in many ways previously unattainable. And if we look at best practices, they're generalizations. So that's the get a mammogram at 40, get a colonoscopy at 50, get the flu shot early in the season. But these really don't apply equally to all 320 million Americans. A really better understanding of genetics is playing a larger role in the early detection and treatment of acute and chronic illnesses. One could go so far as to say that we are now really entering the age of DNA medicine. A short story on that I'll share is I have a couple family members who had been diagnosed and treated with various forms of cancer over several years. And it turns out for two of the individuals that it was actually linked to an inherited cancer syndrome called Lynch syndrome. Until this was identified, it was like a goose chase. It was cut out this cancer, give you chemotherapy, cut out this cancer, give you radiation, and really struggling to understand why two people so young could have the cancers they had that are often not seen until later in life. And then when the programs that are in place for the screening, it would have been too late. So knowing that it was hereditary has changed treatment and has also changed the healthcare path for family members. And as we look at consumer products like 23andMe or Ancestry DNA, they're helping lower the cost of DNA testing, making it available. And I expect, based on market projections, we're going to see a doubling of testing, self-home DNA testing for the third straight year. And we're talking about another 30 million Americans having that test.
Wow. Yeah, I pause only because that's a pretty deep story and inspirational. I would assume that it probably, as you think about some of those stories, it probably could even help influence how you recruit, how you retain, how you motivate, talent to really believe in some of the missions that, you yourself as well as your organization pursue. Switching gears, briefly, Dave, as we think about benefits, what are the benefits to meeting patients, where they are with some of these, mobile and mobile health technologies, from, for example, improving patient outcomes or getting in front of chronic disease, as as you think about those things, what benefits, do you see out there in the market?
Well, I think there's a number of benefits. And when we look at getting in front of a chronic disease, reducing hospital stays, et cetera, again, if we think about the mobile technologies, the mHealth technologies, the consumers are really expecting these things to come to them, but at the same time, we need to focus on making them easier to use as well as sort of unintrusive. So when we look at the things such as interoperability, e-health portals, et cetera, those things are improving. What we really want to see is we need to find ways and improve outcomes with compliance and the ability, for patients to self-report or have devices or wearables that auto-report. So patients can have their lives improved when wearables can be set to auto-alert and send data when indicated, providing a simple user interface. What we're seeing is, we're seeing a big advancement in things like continuous blood glucose monitors and glucose pumps. And we're now seeing a change in these pumps where they're using microdosing, or we're now looking at smaller individual doses. Means the patient doesn't have to stop in the middle of their day and prick their finger and then go to the bathroom with an insulin needle and inject themselves, into their stomach. So these kind of advances are improving the daily life because most of those patients on these new modern systems are able to go about their day and without having to either alter their patterns, alter their work, et cetera, to remain in compliance and to have a safe blood glucose level. There's also things that's happening. I think that we talk about mHealth technologies and mobile is trying to engage people. One of the things that you do is you find ways outside of our episodic care programs, and you do things like competitions, Biggest Loser, to help people who want to adjust their BMI. Right? I participated in a program a while back. It was first team to 1 million steps. Right?
Oh,
so
wow.
I was wearing their Fitbits and their trackers. Or even something like the lowest team A1C. So A1C is a measure that diabetics are very familiar with. So it's not surprising that recent surveys, there was including one by Deloitte, found that the most engaged patients are the healthiest. So it's pretty simple. If you're engaged in your healthcare and understanding, your chronic disease and staying in front of it, you will be healthier. Patients were surveyed in several different cases about acute care as well. And more than 50% were willing to do a home test for strep or for a UTI before going to the doctor, or instead of going to the urgent care for this nagging sore throat and cough. So why would we not want to promote and look at ways to do simple things like a home swab and then send it in and make that diagnosis without having to, travel somewhere of this nature? So there's a lot of benefits to the patient and a lot of benefits to the providers.
Yeah, absolutely. And obviously you mentioned one that is reality for just so many folks out there, things like step challenges and mobile health. And, even me, as an aside, I was in a step challenge for health about 6 months ago with coworkers. I'm in the healthcare, organizations as well. And I'm flying to HIMSS to present at HIMSS and, lost my last day of challenges on flights to Miami. So lost by whatever it was, 4,000 steps after a month of work. But, the outcome of losing is the benefit of all of that healthcare data and improved experience. So super exciting. Even I don't think that many folks, Dave, think about some of the, the nascent or simple things that they do could really have that kind of an impact. Mm-hmm. And speaking of, on the patient engagement side, how do you feel, how can better patient engagement increase ownership that the patient has over their own health?
Oh, sure. I mean, I think if you talk about patient engagement, that's really patient ownership of their health, right? So if you equate patient engagement to patient participant, I would start with a couple old adages, right? An ounce of prevention is worth a pound of cure. That's Ben Franklin's old famous quote. Or, I'm sure not sure we hear it too much these days, but an apple a day keeps the doctor away, right? Increased patient engagement in the compliance, we call it compliance, which is sometimes people don't like that word, but compliance means that you're following along with what was prescribed by your clinician, or you're following along with, dietary restrictions or exercise recommendations. Those things are really a healthcare provider's dream. It means we have healthier patients. And what we're seeing is that the wearable market and wearables promote and bring awareness to factors in patient, their immediately health and their overall health. So when we look at most of our healthcare that's been delivered episodically, meaning we go to the doctor when we're sick or we notice something's not right, otherwise, there really is no other time when people are focusing on their health. And if we think of the change to wearables and finding ways to engage patients, increased awareness is brought out. Wearables, can be set to alert and send data. I would say that if we look at some of the other things that are impacting us, mobile is also changing the way that we can engage with our providers. So, for example, your EHR portals many of them have smart scheduling. So we want to reduce no-shows and wait times. So, for example, you can pick that time that's convenient for you between leaving work and picking up your kids after school, and know that you're going to be there on time for your appointment and you're not going to have to wait. There's just other things that are happening right now. You can visit a Minute Clinic that's conveniently located with a 24-hour pharmacy and see a healthcare professional and pick up your prescribed solution. You can also book these through apps. And so patients being able to say, something's not right, I'm not feeling good, but I can't wait 3 weeks to see my primary care physician. The systems and providers are learning how to give more efficient access. In addition to that, I think when you see is that online, when we get into other things like wearables and we talk about people who have chronic challenges, online video tutorials that are available, things for like my mother, for example, how she has to set up and clean her CPAP machine.
Sure.
And for other patients, it's how to hook up your cardiac monitor. So that's kind of, I think, how the patient engagement increases, and how we can better engage them is just give them an easier set of tools, and then give them the ability to, in the case of scheduling, pick how and where they engage, and not force them into the old traditional model.
Yeah, absolutely. I think that flexibility, with appropriate guidance, I think is really, really important. And speaking of guidance, we often talk about cloud, whether it's public cloud, private cloud, what have you, on this show. And I'd love to know from you, Dave, as you think about cloud, why do you believe that's the right choice for machine learning and some of the topics we've talked about today as it relates to medical devices and wearables?
Well, I think if I think of cloud in the larger context, right, of e-health initiatives and mobile health, one thing that really stands out is that it has opened the door for further patient engagement to start with. So we look not that long ago when all records were sort of locked away in a file cabinet, or they were stored on a server in a server room in the basement of the hospital, and they were only accessible if you were on site or connecting via VPN to the hospital. It was impossible to share. And even kind of worse to that, if we look back close to 20 years, as this big transitions occurred, is that much of it was stored in proprietary formats. And what happened with the move to the cloud has been really a bigger promotion of interoperability. And it's led to the creation of the security and access controls required to keep your data safe, but at the same time, making it easily accessible, for providers and patients. I mean, imagine 10 years ago, someone telling you that you were going to be able to, on your smartphone, which you didn't have 10 years ago, by the way, right? Or from your email link, you'd be able to go in and you'd be able to look at all your lab results and a trend of your lab results, that you'd be able to schedule an appointment with a specialist. The ability to move this stuff out of the four walls of the hospital into the cloud started to improve the engagement. And now when we look beyond that, right, beyond the access, why move to the cloud? And in the context of machine learning and artificial intelligence, what's the value? Well, we have a chance now to use that data, for example, to participate in larger population health studies that use AI and machine learning. So, one of the limitations we faced was that using an opt-in methodology for your university system or your health system, you generally end up with a small sample size. So you're limited to, to regional biases. You're limited to genetic biases due to sample size. I would say at the end, what we're looking to do is we want to use the cloud to access massive amounts of data to train and build algorithms around healthcare. Just last year, participated in a conference at the National Institute of Standards and Technology, and we had a senior advisor from the White House, from the Office of Science and Technology Policy, who participated and led a session on, opening up and discussing ways to leverage the cloud to share data for the advancement of AI and machine learning. Beyond the accessibility, the other thing that the cloud brings in this scenario is that, most all of this machine learning, no matter which approach you're taking, and we won't probably go into all those, is the ability to have access to the computing needs on demand. Because if we look at the processing requirements that are needed to crunch the numbers, right, we can't afford to just continue to deploy, on-site hardware and systems to run these algorithms. So by putting them in the cloud, you're able to, process on demand access to the compute resources that you need, and then you're also able to collect this larger cohort. So I think those are the real big advantages of moving to the cloud is the accessibility to the data, cross-populational data, and then of course access to resources that you could really never afford to purchase and maintain on your own.
Yeah, absolutely. That there are a lot of use cases to unpack there, and I know, from an audience perspective, we may actually need to follow up just because we're running out of time. But Dave, I'd love to, I love to. No, this is great. You've talked a lot about accessibility. Certainly, one of the most important topics as you think about accessibility and cloud is really around security, compliance. I'd love to understand from yourself, not only really leading one of the leading edge organizations that's really changing the game in this space, but also, as you think about security and compliance, what do you really think about in some of these scenarios? What are some of your considerations as you think about, the balance of being able to provide accessibility and cloud with some of the, the regulatory concerns as it relates to security and compliance?
I'd be remiss if I didn't start by mentioning the standards. New products that are out there or existing products have to integrate and communicate following the standards. And I would say that, when we look at interoperability and integration, a lot of it led, by the IAG International Group. It was really about making sure that in addition to making the data available, that we were protecting the patient and the PHI. Interestingly enough, there was a recent report out by the FDA on a study paper done by Liam Tung talking about that hackers are finding ways to penetrate, remote medical monitoring devices. And report that in some cases, devices could be hacked from as far as 20 feet away. Now, I guess if successful, they could reprogram the device. It would allow them to alter or access sensitive patient data. And it's not a small issue. So manufacturers and providers need to be aware that it's out there. I would say that when we look at, companies need to make sure that they're following not only the standards, but they should make sure that they're following and understand the improved consumer patient awareness and taking precautionary steps to reduce, access to any of this data. One thing our device does is we do not transmit patient identifiable data, and the data that is all encrypted in the transmission as well as when we have it at rest. This is not necessarily unique in our marketplace, but it's something that we ensure through every release that we do. Analysts are looking at, connected medical devices. So remote monitoring devices, home medical devices is going to see significant growth. And, I guess one of the key things people should always be aware of is that, as a patient, you should only use home monitoring devices obtained from the manufacturer or directly from your prescriber. Buying a device on eBay or Craigslist is really not advised. And with any electronics, you always want to confirm you're running the latest software and firmware updates so that we can make sure that it's got the latest security protocols applied.
Absolutely. As we close, I recently read an article, I want to say it was in Healthcare IT News or similar, around 71% plus of medical devices out there are still running, unpatched old Windows operating systems and have vulnerabilities. So you're spot on. You think about security compliance. Certainly you want to make sure that you're buying from manufacturer because at least they have a commitment to, to keep to standard, to keep to a best practice, one would believe. Dave, thank you so much for joining me today. To our listeners, thanks for tuning in. If you have a comment about today's episode, please feel free to follow hashtag CTO Talk on Twitter or follow me at MP Ferrari. You can always learn more about CTO Talk at Healthcare Now Radio or at cleardata.com. I am Matt Ferrari. And until we talk again, have a wonderful week, everyone.